And 5, 4, 3, 2, 1. Good afternoon, everybody. My name is Dr. Chris Bird, and we have with us today Tiffany Anderson, Jason Lewis, and Public Health Director Annette Rodriguez to address your questions you have about COVID-19 and the interventions taking place to combat it in the Coastal Bend. This is a new format that we're going to be doing from here forward, and the presentations at the city will continue next week on Tuesday, and then after that all of our presentations will be delivered through social media in pre-recorded presentations that you can watch at your leisure. You can find those at CBCovid, that's our handle. You can find that on Twitter, you can find that on YouTube, Instagram, and Facebook, of course. And so, yeah, we just want to get that information out there. And today, the purpose of this is to have a question and answer session. So I'm going to start it off with some questions for Director Rodriguez, and you should all feel free to chime in on the chat with the questions that you have, and we'll start addressing those questions also. So Annette, since we last talked on Tuesday, is there anything new that's happened this week that you think people should know about?
Well, Dr. Bird, we continue to look at our daily cases because we know that Thanksgiving was just recently, and so we're looking to see how those cases are going up or if they're possibly going down. So we're keeping a real close eye on that. As of a few minutes ago, we have 143 positive cases for today, and we'll continue to receive faxes and continue to go through those positive laboratory reports. But also, the big news, and I think everybody knows this, is the arrival of the COVID-19 vaccine. So everybody's getting real excited about vaccine coming in. There are some people that aren't sure, still if they want to get vaccinated, and that's okay too. But this is very exciting for us. So at the health district, we're doing a lot of micro planning. We're working down the little details of when the vaccine arrives, how we're going to get it out to the different venues, which venues are we going to utilize to disseminate the vaccine to the community. But we're not at the point yet where it's just open for the general population. So it has very specific guidelines as to who can be vaccinated first and when the next tier will come. So we're looking at all of those things currently.
Okay, let's take these one at a time. We've got the questions about Thanksgiving, and then we have the questions about the vaccine. So over Thanksgiving, and I was wondering this myself, was there testing that was being done, say like Thanksgiving Day or over the weekend, or did testing stop?
There was a lot of testing done right before Thanksgiving, so Monday, Tuesday, and Wednesday. Thanksgiving Day, there was no testing that I'm aware of. But on Saturday, the health district did test, and so we did have people that came through those lines. It wasn't a very nice day. It was raining and kind of miserable, but we still had people that were sick enough that felt like they needed to come in and get tested.
Okay, and I noticed that the city and county were still reporting cases, so where did those come from? Like on Thanksgiving, they reported an additional batch of new cases.
Those are coming from the hospitals mostly. Most of the private providers, the physicians' offices are closed for Thanksgiving, but those that are still open, like all of our hospitals, maybe some of the urgent cares, so those reports that come in are coming from those areas.
Okay. Let me just ask Tiffany and Jason really quick. Do we have any questions about Thanksgiving that are coming in from the community? It's okay if the answer is no right now?
No.
Okay.
Yeah, not for Thanksgiving.
Okay.
We also need to get questions, so.
Okay, on my side, instead of somebody asking me a question, I'll just talk about when we expect to see the effects of Thanksgiving on the data. We already see effects of Thanksgiving on the hospitalization data, and we presented on that on Tuesday, where the number of people with COVID in the hospital dropped last week. And it was a very unexpected sort of phenomenon because we didn't see a drop in the cases before that. So because we didn't see the drop in the cases, but we did see a drop in the hospitalizations, that kind of indicates that this was not a pandemic related or epidemiological related phenomenon. It was more of a human phenomenon of behavior changing last week. So what I'm expecting is that about 10 days after Thanksgiving, which would be somewhere around Sunday or Monday, that should be when, if somebody got infected on Thanksgiving, that's about when we should start seeing the mean time to getting a test back, about 10 days after infection, because it takes about 5 days to become symptomatic for those that do. And then it might take a few more days to get tested and a few more days to get those results back. All right, so now we're going to move on to the big question. I think everybody is concerned about the vaccines. So how does Corpus Christi know who's going to get vaccinated first? Who makes that decision?
So the decision is really, it starts at the federal level. CDC is looking at, some guidelines that they're putting in as recommendation guidelines, and then they're allowing the states to actually take the lead and determine, who should be vaccinated initially before everybody else. So for us, that's being made at the state level by the Department of State Health Services. There is what's called an EVAP committee, and that's for people that are experts in the medical field or in public health, are giving recommendations to Dr. Hellerstadt, the Commissioner of Health. And then based on what he receives and what he determines, he's putting together these, what we know as, the category 1, the phase 1A versus the tier 2. He's putting those together for the state of Texas. So we already have the phase 1A tier 1, and we have the phase 1A tier 2. For the phase 1A tier 1, we know that it's hospital staff side with the COVID patients, which makes perfect sense.
Right, definitely.
But it's also the ancillary people that work with those COVID patients. So if you have an X-ray tech coming in, or you have a phlebotomist coming in to draw blood on the COVID patients, all of those individuals, including the custodians, which makes sense, will all be able to get vaccinated as part of the first phase.
Excellent. And then presumably not too long after that, it would be the most vulnerable people in our community that would get vaccinated next?
Well, the phase 1, tier 1 is not just the hospital, it's also the long-term care staff. And yesterday, the ACIP met, the Advisory Committee on Immunization Practices, and they recommended not just the nursing home staff, but also the nursing home residents. And so we believe that that's going to be added into the tier 1, that Dr. Hellerstadt will go along with the ACIP recommendations. And so they'll add in the residents as well as the EMS personnel, people that are actually picking up COVID patients, from their homes because they're calling that they're too sick to drive into the hospital and transporting them to the hospitals, or from the nursing homes to the hospitals, or back and forth. And also home health care workers, including hospice care, who directly interface with the vulnerable and high-risk patients. That's the phase 1, tier 1. So we're anticipating getting enough vaccine for that group. I will tell you, Dr. Bird, that yesterday, some of the entities received notification that they're going to get some vaccine. So unfortunately, the health district is supposed to be the central hub for receiving that information as well. We have not received that information, so I can't even tell you who those individuals were. They're still working on it at the state level.
Okay.
But, we know that there is some vaccine that should be coming, and we still are anticipating around the 16th of December.
Okay, you don't happen to know how many people there are in the coastal bend that fall into these first few tiers? We've been talking about the 1A and 1B.
I don't know an exact number. I do know for healthcare workers for the state of Texas, there is 1.5 million healthcare workers that are in that category. And so in my mind, there's going to be at least enough for vaccine to get those individuals taken care of very quickly. What the state asked us to do was to also categorized. So if we were in tier 2, the health department's in tier 2, and we did receive vaccine, but we only received 50 doses, and I have 120 employees, who would be those first individuals to get those 50 doses?
Right.
So we do have to break it down in case there's a little bit less initially.
Right. Those are tough questions to answer. And just in case people aren't aware, there's about 30 million people in Texas, so we're looking at 3 to 4% of Texas falling into this category, right? Do you know the vaccine that we're going to get? Is it the Pfizer vaccine, or is it a different one? Will it be a combination of different companies?
So initially it'll be Pfizer, we believe, because they went for the emergency use authorization first to the FDA. The FDA committee will be meeting December the 10th to make that determination, and then it'll go to the ACIP right after that, probably the same day after FDA starts making a determination. And so they think by the 14th, we should know that they have their EUA, that they're approved. And so by the 15th or 16th, we should start receiving doses here in Nueces County and the Coastal Bend.
All right, that sounds really close. That's only about 10 days away, maybe 11 days away. That's fantastic. So I read that a high-ranking medical official, I can't remember who it was, but they said that by June, everybody who wanted to get vaccinated would be vaccinated by then. Have you heard anything through your official channels as the public health director about that?
I have not heard officially, but like everybody else, there's a lot of national news. And so, I think that may actually be true because, I know you asked a few minutes ago, Pfizer, while they will be first, we believe, Moderna is right behind them, only by 1 week. And so they put in for their emergency use authorization as well, and the FDA will be meeting about approval for them on the 17th, and then we should be receiving that vaccine on the 21st is the anticipated, EPA for that. And so, and right after Moderna, it looks like AstraZeneca is very close to putting in their EUA, and then Johnson & Johnson. And Johnson & Johnson is one vaccine. So you'll be vaccinated and then you're done when you get that vaccine. So I think June might be a really, good timeline for the general population.
Excellent. And have you received the vaccination cards yet?
No, we have not. So we'll receive that when we receive all the ancillary supplies. So we'll receive the Band-Aids, we'll receive, extra needles, we'll receive all of those things, and we'll have those cards as well.
Okay, and for those that aren't aware, what's going to happen when you get vaccinated is you're going to be given a vaccination card because for some of the vaccines, you have to get 2 doses of it at a particular time period in between the first and the second dose. And it matters which company's dose you got, and it matters the timing of it. So you'll have that card, and when you get vaccinated, you don't want to lose it so that when you go back, when you need to get revaccinated, and it makes sure that you get revaccinated with the right vaccine rather than getting 2 different ones. And we don't know what will happen if people get that sort of combination of different vaccines. You might not even be able to get the second dose if you don't have the card, right?
Well, fortunately, we have a really nice system set up in the health district with our Luminaire, and so we'll know when you got your first dose and when your second dose is due, and we'll also send you an email and a text message saying that your second dose is due. The other nice thing we heard yesterday was that CDC, if they're receiving 4,000 doses for the health district, they're only going to give us 2,000 because they know in 21 days when you need the second dose, they're going to send us the other 2,000. So that's really nice. We don't have to do that math.
Yeah, that sounds good. I think that having multiple systems in place to make sure that we're getting our vaccines at the right time is good. I can imagine that I might lose my card, and then how do I remember when the right time is to go in? So I think that's good for people like me. Before we transition off of the vaccines, are there any questions that we have from the audience, Tiffany or Jason?
There is. Annette just answered the one about the supplying the vaccine. It sounds like the CDC is helping us out with that. Someone else had a comment about posting online that they are in line from an app. They're in the Houston area, and they're talking about how they're in line to get the vaccine. Is there an app that anyone is aware of that we should be looking for, or? to organize this?
I'm not aware of an app. Annette, are you?
No, I am not at this time.
One thing, maybe because of the localized nature and the way that the vaccines are being delivered, different communities might have different mechanisms of doing that. So that's something to consider. I did also see an article saying that there might be, some scams surrounding the vaccinations, and you want to be careful about that.
Another question was, what is the timeline for the COVID vaccine to produce antibodies for the individual who receives it? Do we know?
Well, what we do know is that at day 7, when they did their efficacy testing, at day 7, Pfizer had 95% effective, and Moderna had 94.1% efficacy at day 7. So, and that's day 7 after the second dose. What we don't know is how long will you have antibodies? Will it be 3 months, 6 months, a year? We don't know that yet.
Okay, so we're going to need to wear our masks and social distance until a little bit after we get the second dose.
Absolutely. The masks don't just, go away. We're going to continue wearing that mask actually until we have what we call herd immunity. So that's about 70% of the population actually have antibodies either through infection or through vaccine before those masks can come off.
Yep. And something I asked you before, but I think it'd be a good question for people to hear the answer to. So I got the coronavirus and I recovered, and I was thinking maybe I don't need a vaccination because I already got infected. But that's not the case, right?
No, absolutely not. In fact, they're saying even though individuals have gotten COVID-19 virus, that they still need to be looking for their category to get their vaccine, because there is what we're seeing as reinfection from individuals. And it's been like about a 3-month period, and they're starting to get reinfected. And so we really want to encourage, even if you were COVID-19 positive, for you to look at if you meet one of those category definitions, for you to come in and get your COVID vaccine.
Right. And the way that I understand it, it's that when you get infected with COVID, it could be a variable initial viral load, which will trigger varying responses in your immune system, versus when you get the vaccination, it's a prescribed dose that should trigger about the same response across the population, right? So that's why even if you became infected before, we're still going to want you to get vaccinated also, or you want to consider that, because you don't know if you have long-lasting immunity just by having had COVID. It's the studies are proven from the vaccination, and that controlled dosage and timing of the vaccination.
Absolutely.
Okay, thank you. Do we have any other vaccination questions? All right. So we talked about the past with Thanksgiving, and we talked about the future with the vaccinations. Let's see, now let's get into the here and now and the immediate time. We're in the middle of an outbreak here in the Coastal Bend and across the country at varying levels. The outbreaks are in different stages here. We're going into it. We're still going up in El Paso, Lubbock, and Amarillo that were leading the fall surge. Now they're coming down. But we have some questions, and one of them is a lockdown or curfew a possibility? And I'll start this off by saying that it's right now the way that the regulations surrounding COVID and the interventions work is that the governor has put some motions into place where based upon the hospitalizations, and when there's 15% of the staff beds are filled with COVID patients for 7 days or more, then that allows county and city officials to apply to have the business capacity go down to 50% and bars close. And until that threshold is hit, then we stay at our present level, which is 75% business capacity on average, and bars open at 50%. So there's probably not a lockdown or a curfew possibility here in Texas, but Annette, do you have anything to add to that?
I think there's always a possibility. I don't see it as something that's really going to happen here. So what I like to tell people is just take self-responsibility. You know what doesn't feel right. If you go into a place and it doesn't feel comfortable to you, you shouldn't be there. You know if you're vulnerable or not. If you are in one of those populations that we have been talking about, that's the vulnerable population with comorbidities. So again, don't take chances. You know, right now is not the time to do any of those things. It's not the time to just say, oh, we've got the silver bullet coming, you know, the vaccine's on the way. And so we just want to make sure that you're taking care of yourself. If you do everything in your power to take care of yourself, you will in turn take care of other people in the community. And that's what we're asking you to do. I agree with Dr. Bird. I don't see these things, you know, lockdowns of any sort happening. You know, I think our governor has been very clear about that. But we could have some local, you know, closings of this or that or another, or maybe, you know, some curfews if we needed to. But we're really trying hard not to go back, you know, to that period of time.
Right, and I think one of the ultimate litmus tests was El Paso, where they had an absolutely massive outbreak, and the mayor there tried to shut down the businesses, and then a legal battle ensued, and the governor's council prevailed, where the governor's ruling superseded the 1975 law that the mayor was trying to use. That in an emergency situation, the mayor has the, or it might have been the judge, has the ability to make decisions about what's happening. And in the projections that I've been working on, I don't foresee that we're going to see a situation here like there was in El Paso. But there is some question to how it got so bad there, given the automated nature of when we get more than 15% of our patients being COVID positive after 7 days. These additional measures are put in place. I would have thought that would have stopped the outbreak that they had from being as big as it was. And large outbreaks also occurred in Amarillo and Lubbock. So I'm a little concerned about how we will respond if and when we pass that threshold. And if we kind of have pandemic fatigue and we respond differently than we did to the summer surge, we might end up in a situation like there was in El Paso just a couple weeks ago, where they had 2,000, 3,000 people testing positive in one day. And that's a community that's only 50% bigger than us. So that would be, you know, we're talking about 1,000, 2,000 people a day here testing positive, which we haven't seen yet. But if we, you know, all work hard, wear our masks and social distance, and when the businesses, if and when businesses have to go back to 50% capacity, they follow those rules. Hopefully we can avoid that situation that occurred in other parts of Northwest Texas. Let's see, Annette, do you know, will there be a citywide initiative or a campaign for people to get tested?
You know, I'm not seeing that happening because I'll be honest with you, a lot of people are getting tested. You know, this week alone, we're over 800 people that have been tested for COVID-19. A lot of that has to do with Thanksgiving. So, you know, there's opportunities. If you're just talking about the health district, we're currently we're testing people on Tuesdays and Saturdays. But we're not the only testing site. You know, there are a lot of other testing sites, and people are going anywhere they want to go to get tested. So even to other jurisdictions, like we ourselves have seen as well. So I think, you know, city or county-wide push for that. I don't see that coming. It could be because there might be some antigen rapid testing that we might see in the future. We're really kind of shifting gears, Dr. Bird, if you will, to the vaccine distribution, because we want to make sure that we can get that out and do it, you know, effectively.
Okay, thank you very much. And maybe in my presentation, people thought that what I was presenting this week was all of the tests that have been done, but it was only the tests that were done by the public health department and at the mobile testing stations. I wasn't able to give the total number because there was a data formatting issue that I couldn't solve in time for the presentation. So there were more tests done than what you saw in the presentation that I gave on Tuesday. Okay, I think we're coming to the end here, but there's some questions about our hospital capacity and where we're at in terms of that. And I know that right now, based upon the state's data, we're at about 8 to 9% of the hospital capacity being filled with COVID positive patients. So that's on that scale where when we hit 15%, that for 7 days the businesses would presumably roll back to 50% occupancy. And there's a question about the hospital capacity for the Coastal Bend, and it does fluctuate day by day, but on average right now, the hospital capacity across the whole Coastal Bend, including inpatient and outpatient, is 1,650 staffed beds, plus or minus 25 beds. That was declining over the previous 2 weeks, but then recently it started increasing again. So it was up at 1,700, it declined down to about 1,600, and now it's increasing again. And that may be due to fluctuations in FEMA nurses and hospital staff leaving the area, and then new FEMA nurses and hospital staff coming into the area from my understanding of that. Do you know anything more about those fluctuations?
You know, it is, you know, very fluid, because as they need to add additional COVID beds, fortunately for us, our hospital is able to do that. So those numbers do change every day. What I do receive is actual numbers. So I know today we have 126 the patients that are COVID positive that are hospitalized currently. And of those 126, 38 of them are in the ICU. So I know actual numbers. You know, again, the percentages change based on the staff bed capacity, and that's what I have.
Okay, thank you. Let's see, Jason and Tiffany, do we have any questions from the community?
One last question. Has the projection of when our local cases will peak in December changed since they were reported before Thanksgiving?
Okay, I haven't changed that projection yet, but we're seeing some weird effects because of Thanksgiving, so I'm trying to wait and see how that shakes out. But I would expect right now, our original projection that on December 14th, that would be our 7th day, above 15%. I feel pretty strongly right now that that's not going to come to pass because of the way that the number of people that are positive for COVID in the hospitals declined last week, which was unexpected. And now it's rising a little bit, but not up to where it would be. So we're looking at least some sort of delay to when we hit that threshold, it seems. It's December 4th right now, so we have 3 more days until our original projection said that we were going to hit 15%. So there's still some time to see, but right now it seems like it might be delayed by a week.
You know, I think the other part to add to that is that we did receive monoclonal antibodies, you know, for treatment for people that are positive COVID-19 with mild or moderate symptoms, but they cannot be admissions to the hospital. So we're hoping what we're going to see is that you're going to have more individuals that actually get this new treatment, very similar to the one that the President Trump received, and that they do not have to be hospitalized, and that they can go home and recover just fine and do well. So that might have an effect on our numbers as well. We're hoping all of these tools in our toolbox, if you will help us to keep those numbers down, but we also need the help of the community.
All right, thank you for that. All right, and with that, we're at a half an hour, so I think we're going to wrap this up. We'd like to thank everybody for tuning in, either live or later on if you watch this. Hopefully you found it informative. We are interested in your feedback, so please let us know what you think, or if you have any questions, and we'll try to address those in a future episode. And once again, we'll be presenting live at City Hall on Tuesday at 5 o'clock through the normal channels. And then that will be the last live presentation for myself, at least. I'm sure it won't be the last live one for Director Rodriguez. And then after that, on Friday at noon, we'll continue these question and answer sessions, and I will continue to release a weekly video reviewing the numbers and the projections moving forward on our CBCovid social media on Facebook, Twitter, Instagram, and YouTube. So thank you very much for tuning in, and have a safe weekend, everybody.